Practice Settings, Corrections, Part 2. Ethical Concerns in Correctional Nursing. The right to healthcare, confidentiality, appropriate use of healthcare personnel, refusal of care, abuse of prisoners, and advocacy. The National Commission of Correctional Health Centers has delineated 3 guiding principles for healthcare in community corrections. Medical autonomy. The healthcare professional acts in first promoting the patient's interests and judgment should be based on patient need and not legal issue. Non-maleficence. The healthcare provider should not engage in any action that would lead to harm. Medical neutrality. Providers should provide care to all inmates regardless of background, status, reason for incarceration, and so on. Furthermore, a National Commission of Correctional Health Centers position statement on health professions' responsibility in the event of witnessing harm to inmates indicates that they should not participate in any form of interrogation or abuse, including not providing consultation on such activities, should not gather forensic information or share confidential information with authorities for use in abuse, should not authorize or approve any physical punishment, should promote policies that protect correctional employees who report abuse, and should support training staff for those to present those. Planning and implementing health care for correctional populations. Health promotion involves provisions of adequate nutrition, rest, and exercise, health education, prenatal care, and contraceptive services. General purposes protect the health of others rather than to enhance the health of the particular inmate. Group health promotion efforts may be hampered by the compulsory natures of inmates' presence in the institution. The great majority of offenders are men who tend not to be as highly motivated with respect to the health promotion as women. The needs to focus on information transmission than on attitude development or change. Emphasis on punishment for crimes may result in political interference with health promotion efforts. It may be little time or few resources available for health promotion efforts. Nutritional intake in correctional settings may be far from adequate. The correctional nurse may need to monitor inmate diet, influence administrative decisions regarding nutrition, arrange special dietary needs of specific inmates, encourage facility participation in relevant programs, promote adequate rest and physical activity by inmates, may need to advocate for adequate space and facilities for sleeping, assure that time and facilities are provided for inmates to engage in physical activity, educate inmates and staff on the benefits of, and inmates and staff need a variety of health education efforts, and promote smoking cessation. Also provide prenatal care, addressing adequate nutrition, discomforts of pregnancy, effect of smoking, and other substance abuse on the substances on the fetus, parenting skills, and planning for child care. The nurse can advocate for and help initiate similar programs in low-income, high-risk communities. The use of universal precautions in handling blood and body fluids, isolation of infected persons when appropriate, and immunizations, education on hygiene and condom use during sexual encounters, smoking cessation, obesity reduction, and promotion of physical activity. Identify environmental hazards or occupational hazards, suicide prevention, identify those at risk, and prevention of violence. Components of an effective prevention plan includes initial screening and ongoing identification of inmates at risk and staff training. Inmate assessment by qualified mental health. Recommended components of violence prevention programs in correctional settings include incorporation of violence assessment, including prior exposure to violence as well as intake screening, referral of inmates with a history of personal violence or violence exposure for counseling, education on alternative responses to potentially violent situations for both inmates and correction staff, and referral of inmates for continuing counseling on release. With the secondary prevention, there is a threefold purpose: identifying and addressing the health needs of inmates, promoting early identification of key problems prior to a more comprehensive assessment, and identify and isolate potential communicable inmates. Receiving screening is the collection of health-related information to identify newly arrived inmates who pose a health threat to themselves or the general facility population. Full population assessment or individual assessment. Full is when every inmate receives a comprehensive assessment after intake screening. Individual provides comprehensive assessment when clinically indicated for an individual inmate. Suggested elements of mental health assessment in correctional settings include an inmate's psychiatric history and use of psychotropic meds and presence of suicidal ideation and/or the history of a suicide attempt. Diagnosis and treatment may be required for medical conditions, illness, and substance abuse. Dispensing meds requires that the nurse directly observe the client taking the med, and often only a single dose is dispensed. Treatment for tuberculosis and HIV infections are in long-term nature of therapies and sometimes lead to noncompliance. Issues that need to be addressed in addition to mental health or substance abuse treatment needs include continuity of public assistance, housing support, and the need for social service referrals and treatment of other medical conditions. Research has indicated that treatment of substance abuse while an inmate is in prison reduces the likelihood of rearrest and reduces the return to previous drug use patterns. Other areas of concerns are sleep disorder, dealing with violent and agitated inmates, with 4 basic approaches: de-escalate, seclusion, physical restraint, and pharmacologic restraint. Also needed to address the dementia in the correctional population. The nurse will arrange for appointments, transportation and security supervision, involve an emergent response to life-threatening situation and emergency care of large numbers of persons injured in a human-caused or natural disaster involving the correctional facility. Tertiary prevention is preventing the reoccurrence of problems once they've been resolved. Long-term planning occurs for older inmates or those with disabilities related to chronic illnesses. They may be transferred to appropriate facilities or housing conditions separate from the general inmate population. They may be transferred to assisted living facilities that provide assistance with activities of daily living. Terminally ill inmates may be transferred to specialized hospice units or to community hospices. Inmate housing. Other inmates function as personal care attendants for disabled inmates. Other tertiary prevention activities related to long-term care are providing assisted devices, monitoring the status of a chronic condition and treatment compliance, monitoring for adverse effects of treatment, and providing support in dealing with the emotional and physical consequences of long-term physical or mental illness. Re-entry is the process of leaving jail or prison and being reintegrated into the larger society. 2 challenges inherent in re-entry are protecting the public and promoting effective reintegration into the community. Additional challenges are limited job skills and social support networks. Re-entry planning begins with the development of a systematic discharge protocol to be used with all inmates, developed with input from the communities. There are individual considerations, individual needs assessment, issues related to health care and social and financial needs, particular need for effective communication between the correctional system and community health agencies. For some inmates, re-entry planning may entail assistance with family reintegration, specific programs to promote re-entry and prevent recidivism or repeat offenders, re-entry housing units, and holistic aftercare program for women drug abusers. You may need to discuss advanced directives with inmates and help those who wish to execute advanced directives. Referral for hospice care may be appropriate. Some in-house hospice units need assistance in setting their affairs in order. They may also have a need to reconcile with family members, obtain legal assistance in settling any assets they may have on their heirs, and assist in control and palliative care. 2 unique aspects to end-of-life care is the compassionate release and inmates who have been sentenced to death. When evaluating the health care for correctional populations, especially for a group of inmates or in the entire facility, examine the process of care and make recommendations for improvement, such as quality, efficiency, and cost-effectiveness.